OBGYN Introduction Lecture. Obstetrics and Gynecology. The branch of medicine that deals with pregnancy, labor, and postnatal period is known as obstetrics. The branch of medicine that deals with diseases of the genital tract in women is called gynecology. A physician who practices both is said to be an OB/GYN physician or specialist. The female reproductive system. Image A shows the outer female reproductive system. The clitoris is at the top, and you can see the labia minora and the labia majora, which are the outside of the female reproductive system. You will then see the vaginal opening and the urethral orifice. Image B shows the internal female reproductive system. We have the anus, which goes into the rectum, and then from here we have the labia minora and majora, which is the outside reproductive system. We have the bladder, which is the first opening. The second opening is then the vagina, which goes into the cervix. The cervix is the gatekeeper of the uterus. The uterus is this big mechanism here, which is then hooked to the fallopian tubes, which then go to the ovarian fimbriae, and then the ovary is at the end of the ovarian fimbriae. Here's another picture of the internal female reproductive system. It is important to note that the fimbriae do not attach to the ovaries. The ovaries release the egg, and the fimbriae help guide the egg into the fallopian tubes to be transported to the uterus. The uterus has three different layers: the endometrium, which is the very inside, the myometrium, which is the muscular layer, and the perimetrium, which is the very outside. We then have the internal cervical os and the external cervical os, which then goes down into the vagina. The fallopian tubes are also called oviducts and extend from the uterus to the ovaries, but do not connect to the ovaries. Fimbriae help draw the released ovum into the fallopian tube. The ovaries produce and release the ovum. They excrete the hormones progesterone and estrogen, which are necessary for the development of sexual characteristics in women and to maintain pregnancy. Menstruation is when the body rids itself from the thick endometrial wall that develops in the average of 28 days and is usually in a 28-day cycle. There are three phases. The follicular phase is day 9 to 14 in the cycle. The luteal phase is day 15 to 27 in the cycle. And the menstrual phase begins at day 28 and the cycle starts over again. Menarche is the beginning of the menstrual cycle when the girl enters puberty. Menopause, which is the permanent ending of menstruation, which is the opposite of menarche, and as a result, the cessation of ovarian function. It usually occurs between the ages of 45 and 55 years old. Perimenopause begins when the hormone-related changes start to appear, and it lasts until final menosis. This can occur as much as 10 years prior to the actual menopause stage. Some symptoms of menopause are hot flashes, concentration problems, mood swings, irritability, migraines, vaginal dryness, urinary incontinence, dry skin, and sleep disorders. Some medications to help some of these symptoms are oral contraceptives, hormone replacement therapy such as Premarin or Prempro. Vitamins such as vitamin E can also help with some of these symptoms. Patients that enter menopause are also at higher risk of osteoporosis and therefore may need supplements of calcium with vitamin D and may need to be placed on medications such as Boniva, Fosamax, Evista, or Actonel. Some menstrual disorders are amenorrhea, which is the absence of menstruation for more than 6 months. Oligomenorrhea is the absence of menstruation for 35 days to 6 months. This is typically our patients who have a menstrual cycle every 2 to 3 months. Menorrhagia is excessive menstrual blood loss, and metrorrhagia is spotting or bleeding between menstrual cycles. Pelvic region disorders is a weakening of supportive structures of the pelvic floor that can result in multiple structural disorders. A cystocele is a protrusion of bladder into the anterior wall of the vagina. A rectocele is a protrusion of the rectum into the posterior wall of the vagina. And a uterine prolapse is when the supportive structure is lost and it drops down into the vagina. This often leads to patients having to have a hysterectomy. Kegel exercises contract the muscles that make up the pelvic floor by visualizing that you are stopping the flow of urine midstream. Hold the contraction to the count of 3 and then slowly relax for the count of 3. Repeat the exercise until you are performing 10 to 15 contractions in a set with up to 3 sets throughout the day. Endometriosis is characterized by functional endometrial tissue outside the uterus. Endometriosis causes inflammation at the site that recurs with each cycle, ultimately leading to adhesions and obstructions that affect tissue. This can lead to infertility. The primary symptoms of endometriosis is dysmenorrhea and dyspareunia. Treatment can include the use of hormones, such as birth controls, or laparoscopy or total hysterectomy. There is no cure for endometriosis that is known, but pregnancy, breastfeeding, and natural menopause frequently cause remission. This is a picture of where endometriosis can occur within the body. B is, on the left-hand side, a right ovary which had endometriosis. And this one is an ovary with a cyst. Infections that can occur are candidiasis, which cause an overgrowth of yeast-like fungus, which causes itching, dryness, and discharge. Bacterial vaginosis, often called BV, occurs when secondary bacterial growth and infect the tissue lining of the vagina and cause discharge, odor, pain, pruritus, and burning. Cervicitis is the inflammation of the cervix caused by an invading organism causing discharge, odor, and dysuria. And pelvic inflammatory disease is an infection of the reproductive system often caused by treated infections or following medical procedures and can cause infertility. Fibroids, the most common are uterine fibroid tumors, are composed of hormone-sensitive cells. Menorrhagia is common. Pelvic and abdominal pain and distortion can happen, and it can be a cause of infertility. Benign tumors are often ovarian cysts, which are treated with birth control pills or surgery. Polycystic ovary syndrome causes cysts to develop over enlarged ovaries. Some symptoms are irregular or no menstruation, high testosterone levels, excessive body hair in a masculine pattern, acne, and male pattern baldness or alopecia. Cervical cancer is almost all cervical carcinomas are caused by HPV, diagnosed by the Pap smear, and age and risk factors determine how frequently Pap smears should be performed. The current guidelines for anyone with a normal Pap smear is every 3 years. If you've had an abnormal Pap smears can be as frequent as 6 months to 1 year, depending on your condition. Ovarian cancer, leading gynecological causes of cancer death in women, and symptoms do not appear until tumor is large enough to cause pressure on internal structures. Pap smears and colposcopies do not detect ovarian cancer. Endometrial cancer begins with hyperplasia of the endometrial wall followed by dysplasia. Treatment involves complete hysterectomy with radiation therapy and sometimes chemotherapy. What are risk factors for endometrial cancer? Obesity, irregular ovulation, not having children, and early menarche and late menopause. The normal female breast, as you can see, has lobes and lobules and lactiferous sinuses and lactiferous ducts, and contain several pockets of adipose tissue. Mammary tissue develops from an increased estrogen secretion that occurs during puberty. The nipple is surrounded by a pigmented region called the areola. The mammary ducts respond to elevated levels of estrogen and progesterone produced during the menstrual cycle by increasing in size, resulting in a premenstrual fullness and tenderness of the breasts. Prolactin stimulates the production of milk, and oxytocin causes the ejection of milk from the glands. Fibrocystic breast disease is when there is an enlargement in the lobules, as seen here. Fibrocystic breast disease is characterized by the presence of multiple palpable nodules in the breast associated with pain and tenderness, and fluctuates with menstrual cycles. Over time, the cysts enlarge and the connective tissue of the breast is replaced with dense, firm, fibrous tissue. How does the disease affect one's risk for breast cancer? Although the risk of breast cancer is not increased with fibrocystic breast disease, the diagnosis of cancerous breast mass become more complicated because of breasts consistently feel lumpy. Breast cancer is the second leading cause of cancer deaths in women. The risk factors are family history, early menarche, and late menopause, first pregnancy after the age of 30, prolonged use of estrogen replacement therapy, and smoking, obesity, and excessive use of alcohol. Breast cancer treatments almost always begin with surgery, either lumpectomy or mastectomy. Radiation therapy is used as a follow-up to destroy any remaining cancer cells, and sometimes axillary lymph nodes must be removed if the cancer has spread. It is important to note that anybody who has lymph nodes removed with a lumpectomy or mastectomy should not have blood pressures taken in that arm due to the increased risk of lymphedema.